Welcome to Dr. Lottie's Science with Soul. I'm Dr. Lottie and the host of this podcast. Today, I'm really excited to introduce Dr. Oskin. And Dr. Oskin was actually one of my teachers in medical school. And he is just an amazing person. And I can't wait for you all to learn about his work and what he does. So let me read a short bio to introduce him. Dr. Oskin. Dr. Oskin's passion for developmental pediatrics began as a resident. He can still vividly remember helping a 22-month-old baby boy with recurrent ear infections and speech delay. Over time, as Dr. Oskin was able to help more kids, he decided to also focus his efforts on helping children with Autism Spectrum Disorder, or ASD, including helping with speech delays, developmental and learning delays, sensory problems, seizures, tics, behavioral tantrums, and problematic moods. And over the years, Dr. Oskin has become an international speaker and expert on the natural treatment of autism, and his work has been published widely. He is very active in educating new generations of doctors as a guest lecturer and former faculty member at the Sonoran University, which is formerly known as Southwest College of Naturopathic Medicine, in Tempe, Arizona, where he also attended medical school and completed his residency training. He holds the esteemed Diplomate, Advanced Specialty Status, DHANP, from the Homeopathic Academy of Naturopathic Physicians, HANP, and he also volunteers as the current president of the board. So welcome, Dr. Oskin. It's such an honor to have you as a guest today.
Thank you. I'm so grateful and honored to be here.
I can't wait for you to share. You have just hold so much knowledge about homeopathy. So let's start with explaining what is homeopathy for those listeners that don't know what that is.
Homeopathy is really an amazing therapy. It's a safe, gentle, natural system of medicine using these safe, gentle, natural medicines. They're all naturally derived medicines, but they stimulate the body to self-heal through a principle called like cures like. And you could think about it, probably the analogy that most people can recall off the top of their heads is like allergy shots. You know, if you're allergic to something and you go to an allergist, they will actually give you a tiny dose of something you're allergic to. And through those allergy shots, it helps the body actually develop tolerance and rebalance. And instead of having an overreaction to the allergy, that immune system actually calms down and balances out. Now, if you gave the person, let's say, a really big dose of the allergen, they might overreact and have a really big allergic response. But in a tiny dose, the body actually has this recalibration, this homeostasis that happens, that it rebalances and helps them get back to health. Another example is like exercise. You know, there's that good old saying by the philosopher Nietzsche: "What doesn't kill us makes us stronger." And in some sense, homeopathy is a mild stressor using a safe small dose of a medicine, but because it's like cures like, it actually triggers a similar reaction as the disease state you already have, and then the body has a healing reaction to that. So think about like exercise. If you don't exercise, you don't really stress your muscles, so they don't get any stronger. And if you were to exercise too hard, you might actually hurt yourself, right? But just enough exercise, you might actually get a little sore. And then your body compensates to that mild stress by getting even healthier, even stronger. You have increased muscle growth, etc. And not only that, every prescription is individualized to the unique patient symptoms in front of us. So we don't just give a medicine based on the diagnosis, but based on the unique constellation of symptoms that each person has. And if you think about exercise, if you wanted to prescribe the right exercise regimen for somebody to have a good response, an adaptive healing response to increase their exercise tolerance, and let's say they wanted to be a bodybuilder, but all they did was run and do cardiac exercise, is probably not the right type of stimulus to elicit that response from the body to get the result you want. So in that way, we individualize the medicine to stimulate self-healing, balancing, and restoration.
Wow, it's amazing because it's your own body that's doing the work just by being stimulated. So these homeopathic remedies, what are they made out of?
That's a great question. They're all natural substances, most of which were well-known medicines historically throughout the medical literature going back, several hundred years. And some of them are still medicines today, like digitalis, for example, is it comes from a flower, but it's a plant, but it's still used in medicine as a heart medicine. So most of the medicines are made from like plant substances, like herbal medicines. Some are made from minerals or metals, but all occurring within the natural world. Some actually are medicines that come from animal-derived substances, like snake venoms, etc. So they're very interesting medicines, but now that might sound a little odd, giving a snake venom. But remember, we're giving homeopathic medicines, we give in extremely diluted, safe doses.
So what kind of pediatric developmental disorders can you treat with homeopathy?
That's a great question. We can help a lot of kids. This is my area of passion. I love helping kids and seeing them flourish. And we can help everything from speech delays. That's one of the biggies that I've really seen so many kids flourish. And it's the most heartwarming thing to see a child develop speech and their world just opens up. We're able to help a lot of kiddos on the autism spectrum. I work with kids with tic disorders, even seizures, and often seizures, they also have cognitive delays. Like I have a boy right now who they thought had genetic seizures, and he has 9 different types of seizures and has failed 14 different types of seizure medication protocols. And his seizures have been drastically reduced with safe, natural homeopathic medicine. Kids who get chronic recurrent infections that like ear infections that also affect speech, those we can very much help. So language delays, sensory processing disorders, big time, we can help sensory symptoms, tantrums, those kind of things. And then because homeopathy is holistic, we can help other things that come along with that, like recurrent ear infections, allergies, asthma, skin rashes, etc., digestive problems.
So the ear infections and the toddlers, I had one of those kids. And it was just one ear infection after another. And they wanted to put tubes in. Now we figured out he was allergic to milk, and we took the milk away, and that helped clear things up. But boy, would it have been nice to have you around when he was a little boy. He's in his mid-30s now. But for these kids, if they already have tubes, let's say, and the ear infections keep going, and they keep getting recurring ear infections, can homeopathy help with those types of conditions?
Absolutely. So in my bio, there was that brief snippet about this little boy, and he's just like, this case that really sticks out in my mind because I was a young doctor and it really inspired me to want to work with children. And now that little boy is a teenager. So you could kind of dates how many years ago I was treating this little boy, but he was 22 months old. He had 15 rounds of antibiotics in 22 months for ear infections, and he had ear tubes, and the ear tubes weren't going away. And with homeopathic treatment, he made a dramatic change. I think maybe 6 months after I started treatment, he had one more ear infection, and the family was out of town at Disneyland, and they took him to urgent care and treated him with antibiotics. But other than that, when they were out of town, aside from that one incident, he never had another ear infection. He went from being language delayed to language advanced. The kid's thriving. Now he's, a teenager. And so, the thing is, like, if a child gets these recurrent ear infections, the antibiotics might help each specific ear infection, but they're not really changing the underlying susceptibility or predisposition of the child to keep getting sick. And so, conventional medicine, they're good at treating that acute illness, but not necessarily helping the chronic disposition. And that's what's so beautiful about homeopathy is we actually, we stimulate the child to be more healthy from the inside out. And as a result, they stop getting sick. They stop getting these recurrent infections and what have you. Now, like you mentioned, dietary intervention can be very effective if they have like a food allergy and that kind of thing. What I've found is that often over time, as children respond well to their homeopathic medicine, they actually become less sensitive to their food allergies or food sensitivities, and therefore can tolerate those foods without getting sick from them. So it's almost like their whole body becomes more healthy. And kind of like similar, I have a patient right now who was a little boy who was constantly sick, actually siblings, both constantly sick with various different illnesses, everything that came through school. And, I've been treating them maybe since the fall. And one little boy had a really kind of basic homeopathic case, and he would get tummy aches in addition to these frequent illnesses. And he hasn't been sick at all this entire school year. And the mom's just like amazed. But it's kind of the magic about, once we help change the milieu on the inside and the child is healthier, they seem less susceptible to all the stressors of outside life, including, like bugs, like viral infections and that kind of thing.
Yeah, homeopathy is definitely amazing. There's so many cases I remember from being on shift in school that people would recover from, the weirdest things, that they've been sick for years, and they would come on the shift because they didn't know what else to do. And I mean, just witnessing that over and over is just amazing what homeopathy can do. And when you treat autism, is there any specific symptoms that are more treatable with homeopathy for autism?
That's such a good question. I have had really, really good success treating language delays and improving cognitive delays. I would say that it's not, I don't want to give people the false impression that every case is like a miracle cure and you can take, let's say, a severely autistic child who's in the mental retardation stage and make them totally neurotypical. But what we very typically see is that as we treat the child, they become healthier and healthier, and they go from, let's say they're in a severe disability special ed classroom in school, and then I treat them for 1 or 2 or 3 years, and now they get moved to the moderate disability classroom. And then over time, they even move to the mild disability classroom. Or if I get a child who's in the mild classroom, they may even be neurotypical. I just had a case that I've been treating for about a year. The girl could barely talk and was very delayed. After a year of treatment, she started talking, doing really well, and was basically mainstreamed into kindergarten. So that possibility is there. The language delays, the sensory processing things, I think there's no other therapy that I know of. If you know of one, tell me. But in conventional therapy, what they do with these kids is what's occupational therapy. They call it exposure response therapy, to try to expose them to the thing that stresses them, like noise, and gradually develop tolerance over time. In effect, it's actually homeopathic. It's like cures like. They're exposing them to the thing that stresses them, but they're just doing it from an environmental stimulus. What we do is we use a holistic, safe, gentle, natural medicine to help kind of like turn down the volume knob on the sensory sensitivities and make them more balanced. And I've not found a more beautiful therapy than homeopathy to recalibrate the senses. And I've seen this in little kids with really sensitive sensory symptoms, and even young adults who are autistic, that their entire lives they've been sensitive to like smells and noises, that they can tolerate these things that they haven't been able to tolerate their entire lives. So those things we help a lot. And then tantrums, violent behaviors, those are also symptoms that really are well treated by homeopathy.
So for a child, let's say with autism, that comes to your clinic, what is the expected timeline to start seeing any kind of improvements?
Another really good question. So, very often with a very well-selected homeopathic medicine, parents will start to notice a difference in the first 1 to 2 weeks, and definitely within the first 4 weeks. If they haven't seen any change within 4 weeks, I definitely tell them it's the wrong medicine. It's not going to help them. Let's not lose any time. Let's move on and select a different homeopathic medicine. But very often, even in those first few weeks, we notice a change, like a 2-year-old who's nonverbal and basically indifferent to the world and sits alone, kind of staring at the wall or stimming and not engaged with the world around them, not answering their parents when their parents call their name. Even after about 2 or 3 weeks, I consistently hear parents say things like, we've had a 50% improvement in their turning their head to respond when their name is called. So when the right remedy is selected, we start to see gradual improvement in the beginning. Now, that doesn't mean that they're cured of the autism, but we start to see improvement. Now, when we treat these kids, neuroplasticity is the ability of the brain to be plastic and adapt and change and heal. And so that can happen continually. And I've had cases where I've treated 7-10 years where they came to me, and when they came to me, they were severely autistic, like violent, nonverbal, etc. And as those symptoms go down and the child gets healthier and healthier, the new symptoms become the more prominent thing, and we continue to work on healing those. And so I've had kids where, those violent symptoms maybe got better in the first few months, first several months of homeopathic treatment. But even when I was treating them 5-6 years later, we're working on things like cognition, speech, focus, and restlessness, ability to sit still in class, their sensory sensitivities, OCD, and they just keep getting gradually better and better. So with a long-standing case like that, especially when the child is really severely autistic, slow and steady wins the race. We might start to see improvement in the first couple of weeks, but the course of the whole brain healing, continues to gradually improve over several years.
It's just amazing. So do you also treat children with ADD or ADHD?
I do, and also pandas, which is exploding, unfortunately, with these kids who have basically an autoimmune reaction to strep infections, and then all sorts of involuntary movements and tic-like behaviors, severe OCD, sometimes really severe anxiety or behaviors, and just not a lot of effective treatment with conventional medicine, and homeopathy seems to work quite well.
Yeah, it's just amazing. To hear you talk about and how these kids are improving, because our conventional medical system is not that great at treating things like that. So you were talking a lot about the younger kids. Is this something that can also help young adults or teenagers on the autistic spectrum?
Absolutely. The beauty about the brain is that it is so plastic, and it can adapt and it can heal when given the right circumstances. And in my experience, the most dramatic reversal and full on dramatic changes like speech delays, et cetera, happen when we treat the child young. But we still can have dramatic change in a young adult. And so I'll give you an example. I have a patient right now who's 29, and he came to me when he was 25, and he could talk, like he could phonate, but it was like gibberish. I didn't know what the heck he was talking about. It didn't make any sense to me. I would ask a question, say something or other. It didn't make any sense. And he also had really severe bowel problems on most of his life, which we find in a lot of kids on the spectrum, like either constipation or diarrhea, painful bowels, and really severe sensory symptoms. So severe that we would sit in the dark in my office, and this young man would wear the wraparound glasses that you see like grandmas wear, like they go over the other glasses and cover all the way around so no light can get on the sides. And we would sit in the dark because he couldn't tolerate the lights being on. And he was very, very sensitive to odors in terms of these sensory symptoms. It was almost like he was offended by the world through his sensory symptoms. It was painful to him to exist. It was painful to live because his sensory symptoms were so bad. And now that I've been treating him for 4 years, he's gradually gotten better and better and better. He no longer has digestive problems. He has normal bowel movements, no pain. He doesn't wear sunglasses anymore. He'll wear like normal sunglasses if he goes outside for a walk in a sunny day in Phoenix, but doesn't need to sit in the dark without the lights on. His family is Indian, and so you can imagine they cook with really odorous spices, and he would get angry that his whole life he's had to endure his father cooking with these spices, and especially cilantro, which just bothered him so much. And now he's like, it doesn't bother me. I can be around while they're cooking with these things. And not only that, now he can have a back and forth conversation that actually makes logical sense. He's not fully independent, like he doesn't hold a job, but the parents are elated because it's given them an incredible amount of freedom. For example, in the first 25 years of this boy's life, they never took a vacation because they couldn't leave the boy alone, and it was too stressful to take him on a vacation with his special needs. And just in the last few years, they have been able to go on vacation and leave him home, and he is matured and become independent enough that he can cook for himself. He can take care of himself for a weekend while they go out of town. He can go to the grocery store by walking there and buy himself food. He can take himself, he likes to exercise, so he'll go to the gym and work out. So like this young man at 29, his life has been transformed in terms of his whole health, his digestive symptoms, but his ability to talk and communicate, his sensory symptoms. And so I never give up hope. I don't care what age they are. It may be more slow and gradual to help heal, some of the symptoms when someone's older, like a young adult or an adult. But I never give up hope because the brain can heal. So, that's kind of one example about neuroplasticity in a young adult.
That's just an amazing story. Thinking that, we often think that toddlers, they're still growing and they're more plastic, right? Their brain. But here is a young adult, or he is an adult, that improved that much over a few years. That's just amazing. I can imagine that those parents were so happy because it's just shifting not just the young man's life, but the whole family.
And he can now, this is, as a parent, you can probably relate to this, but this is what, just makes, it makes me teary when I think about it, but also just like, this is why I'm so passionate and love helping. He was so sensory sensitive and also so angry with his, feeling offended by the world with how painful life was. He wouldn't hug his parents his whole life. And now he says he can accept hugs from his mother, and he can talk to her because he can communicate. It's like the world has opened up. And as a parent, if you can imagine what that feels like to be able, you love your child so much, and to see them in such pain that they are hurting so much that they can't even accept a hug because, their sensory system is so on fire. And then to get relief enough that they can accept that love is just like, it's transformational for a family.
Yeah, just amazing, just amazing. And do you see any differences from treatment of a young or older child with autism spectrum disorder?
Yeah, so the spectrum is really wide. So some kids are much more severely disabled, and some have more mild symptoms. And so there's two aspects to it. Age is one, and the other is severity of diagnosis. So in terms of age, I always say that the younger we can start, the better, because the brain is, the older the brain gets, the more rigid those neural pathways get. And so the slower the process of neuroplasticity. But by that last example, you can see that the brain can change and heal even in a young adult. It just takes longer. Now, the other thing to consider is how severe are the symptoms. So when we start with a child who's very severely affected on the autism spectrum, we expect the changes to be more slow and gradual than a child that is, let's say, more mild on the spectrum. Though, the child who's more mild on the spectrum, we may expect that within a year or two of treatment, maybe they can be neurotypical or almost neurotypical or mainstreamed in some classes at school. Whereas a child who's really severely on the spectrum, we expect that to be more gradual.
And for people who are listening and thinking, wow, either my own children or my grandchildren, or they know kids that could use this kind of homeopathic treatment, how do they go about picking a good homeopathic practitioner for that child?
That's such a good question, because there's a lot out there that goes for homeopathy. And what I would say is that we need, as a parent, what I think you should look for are a couple of things. Number one, somebody who really understands autism and has a lot of experience with it, because if you go to a general homeopath that sees all kinds of conditions, they may have some success helping you with a child on the spectrum, but to go to somebody who does this day in and day out, they really understand the condition and the symptoms that these kids suffer from. So they're much more familiar with the medicines, the homeopathic medicines that will help these kids, and have a lot more experience managing things during the ups and downs over the course of treatment. So that's number one. Go to a practitioner who has experience with autism. Number two, I would say go to a practitioner who has a specialty in homeopathy. Now, for me, I'm a naturopathic doctor, and I did both a first-year residency in family medicine and a second-year specialty residency in homeopathy as a specific therapy. And I've obtained the DHANP, which was in my bio. But if you go to look for doctors, the HANP website, it's a little plug, but I'm the president of the organization. It's a nonprofit, HANP.net. You can see the doctors who are most rigorously trained as experts and specialists in this therapy within the naturopathic medical profession. So those are the doctors that have gone above and beyond in terms of their postgraduate training and passed board exams to get the specialty designation. So that's a place you can go to, the HANP.net, look for doctors on that website. And those would be my recommendations to get a doctor that's really well suited to help a condition as complex and can be challenging for parents like autism.
And if the child or young adult is already on other medications, does that then interact with homeopathy?
The good news is the homeopathic medicines are really, really safe. And I try to make it a rule not to change anything when they come to me. So if they come in on other medications, like let's say they're on an antipsychotic because of violent behaviors, or an anti-anxiety medicine, or even an ADHD medicine, and we commonly see these medications prescribed with, my personal experience is limited benefit. That's why they end up coming to see us. But I don't change that in the beginning. I just treat them homeopathically because they're still, when they come to me, still having symptoms. So then as the child gets better, we gradually wean their medicines, most often by sending them back to the prescribing doctor. So yeah, we can still help them while they're on those medications. They won't interact. It's very safe. And then slowly over time, wean them.
Just amazing. So there is really no reason for not trying homeopathy.
Not in my mind. I think it's
Right.
I think it's one of the most amazing therapies out there.
Yeah, I mean, it's just amazing, the things that I've seen myself, and I do a myriad of other things. So homeopathy is just a small piece of my work, but I'm always amazed how well it works. It's just fascinating that these little tiny pellets that just melt in your mouth in a minute can provide such huge healing for people. It's just amazing.
It is amazing. And you know what? I'll tell you something. When I was in medical school, I was skeptical of it. It sounded kind of nutty to me that you take these small doses of medicine that are so dilute and that it would actually do something. And it wasn't until I experienced it myself and had healing of an injury that was plaguing me that couldn't get better, and it healed like that I was like, wow, there's something to this. And even just this past week, it wasn't a big deal, but I had a day where I got a really bad headache. I have a 2-year-old and a newborn, and there's you can imagine there's not very much sleep and stress and everything. And so I had a day where I just had a really bad headache. And as the day progressed, it was getting worse and worse and worse, to the point that I was nauseous when I came home and my wife was needing help with the kids. And I was I need to lay down. And she, at first she thought I was kind of faking it. And then she saw, she was like, wow, you're really sick. And I had tried 4 remedies that day. By the way, I don't recommend being your own doctor. It's not the most objective thing. But I had tried 4 remedies with no response. And you would think if placebo worked, that one of those would have worked. And then finally, developed a symptom and it clued me in, and I realized what remedy I needed. And I went and I took the remedy, and it was like almost like as it was dissolving in my mouth, I could feel myself getting better. Like the chills went away, the nausea disappeared, and I no longer felt like I needed to vomit. The headache went away. And then within like 15 minutes, I was helping my wife with the bedtime routine. And I was like, every time something like that happens, which, thankfully I've been fortunate to have homeopathy help me in my own health many times, but it always amazes me. I'm like, this is the most crazy thing, that these small doses of medicine can be that powerful and that amazing, but they really are.
Yeah, and the importance of getting the right remedy, because many times people will tell me, oh, I got this remedy at Sprouts for a cold or whatever, and it didn't work. And I tell them it's because it was the wrong remedy.
Right.
It wasn't the right one. But look, if you go to Sprouts, for example, they have those little racks, or Whole Foods with those little tiny blue tubes that is about the size of a chapstick.
Yep.
Right. That is the homeopathic remedies. But in reality, when you work, how many different homeopathic remedies are there?
Well, they're probably about 1,500 or 2,000 in the pharmacopoeia, the United States pharmacopoeia, homeopathic pharmacopoeia, that is. But I would say that we commonly use about 125 or less. They're the most commonly used medicines we use most often, although there are a lot. Now, it's still 125 is a lot. So, my job as an expert in this is to help individualize to know what medicine a specific patient needs in a specific state of disease.
Yeah, so it's important to work with somebody like you that really understands what each of those remedies can do for that person, because it's important to get that right remedy.
Sure.
To have those incredible recoveries from different symptoms.
Especially from more intense chronic conditions or severe acute conditions. I wouldn't recommend self-treating. Now, if it's something simple like, you got a really bad bruise because you smashed your hand in the car and you go and get arnica at Sprouts, those are really safe things to do. And, I think that's a good use of over-the-counter medicines. But, certainly something is chronic and challenging in terms of the complexity of the condition as autism, that I really recommend working with somebody who really knows what they're doing.
And the same thing about the dose, right? When you go to Sprouts, I think they sell maybe 6C, 12C, 30C or something. Mm-hmm. But in reality, there's more doses available, right?
Yes. And, as a convenience to our patients, we stock many medicines and many potencies so that we have those available for our patients. And of course, we can order them in, the basic ones, like you said, the common medicines and the common low doses are available over the counter.
So how can people learn more about your services?
So, the easiest way, my office, the phone number is 480-456-0402. Our website is aznaturalhealth.com. That's AZ like Arizona, naturalhealth.com. And then we have, there's a page on there for our Autism Center that you can access on that webpage. And that's probably the best way for people who are interested. I also have a Facebook group specifically for autism called Homeopathy for the number Autism. And people can find us on there. I do tons of free education on there, teaching people about homeopathy, teaching them about all the nuances with homeopathy, teaching them about all the various things about the medicine, but also we answer questions, we give cases, we have parents who come on and talk about their experience. So that's a great group to join. And if you're a practitioner and you want to learn more, I've taught extensively, some at the naturopathic medical schools and online. And I have a website, droskin.com, where all my publications are available, which are not really for parents, but more for practitioners. And also I have some courses there, including a course on the homeopathic treatment of autism that is available online, and doctors can get continuing education credit for it.
Wow, just amazing. And I want to thank you so much for taking the time to be a guest on the podcast today. And I will also put your contact information in the podcast notes. So the phone number will be there
Thank you.
and your website. So people can just click on that and easily find you. So again, I just want to thank you so much for taking the time to be a guest today and just sharing so much information with the listeners. It's just been such an honor.
Thank you so much.